Hello everybody and welcome back to my monthly blog. Thank you as ever for watching. So today I'm going to talk about something for men, which is an unusual thing because we mainly do women's stuff because it's the women who watch and seem to feed back to me. However, I think this one is for men and women because we all have partners, or lots of us have partners that we can share this with, or sons or cousins or uncles. You know, there are men in our lives, and this is a subject which is controversial, doesn't get a lot of coverage, but may be important for someone you know, and that is andropause, the male equivalent of menopause. And the other name for this is testosterone deficiency syndrome. And I think it's really important to cover it because although it's controversial, if it exists or if it's affecting someone, then it's important. And it goes some way to both sexes understanding each other when they go through this part of their lives, because it is the same kind of age that men and women are affected with andropause and menopause. So I've said it's controversial. What is it? It's a term for the decrease in testosterone levels in men as they age. It doesn't happen to all men, and symptoms don't affect all men. So it's just the same as menopause in terms of symptoms. Some women get no symptoms at all, and other women get all of them or a combination of them. And it's the same for andropause. As I've said, it's caused by the reduction in testosterone, which definitely does happen to men as they age. Testosterone is the male hormone, just as estrogen is the female hormone. Testosterone is the male hormone, and it's produced from the testicles and from the adrenal glands. It performs functions very similar to estrogen, but for men. And it's involved in things like sexual desire, development of sexual characteristics, so testicles, penis, deep voice. All of those things are governed by testosterone as boys go through puberty. It's important in physical and mental energy, muscle mass, and also the fight or flight response. So it is a really, really important hormone for men, just as estrogen is a really important hormone for women. So before we go on to talk about the natural loss of testosterone that all men see, it's important to know that there are other things that can cause testosterone to drop in men. And that's why it's always important to know what's causing it, because other things need other treatments. So an injury to the testicles can certainly cause it, chemotherapy for any kind of cancer, pituitary gland disorders. So the pituitary gland is a gland in the brain that manages hormones and hormone feedback. Medications, and this is really important. So opioids, things like codeine and morphine, can cause your testosterone to drop. Steroid use. Now, for all those guys out there at the gym pumping themselves full of steroids so that they get bigger muscles, they will also get, as a side effect of that, smaller testicles and penis and grow breast tissue, because it does suppress your testosterone. So it's really important not to do it. I mean, what woman wants a man with great big muscles but shrunken testicles and penis and breast tissue? Not this one, I would think. And I would think many more as well. So steroid abuse is really important, and to think about the side effects. If you're taking hormones for prostate cancer, the whole idea of that is to suppress testosterone. So again, you may get symptoms from that. And lots of men on the hormones for prostate cancer do get menopause symptoms. Alcohol abuse and liver cirrhosis lowers testosterone, renal failure, obesity, uncontrolled type 2 diabetes, and children that are born with a congenital defect that lowers their testosterone. That could be lots of different things, from hypogonadism to Klinefelter syndrome and so on. So there are lots of other causes, I've only named some of them here, that lower testosterone, and it's important therefore that if you're worried you get checked out and investigated. So when does it happen? Well, again, it's very similar to women. So testosterone for men is at its highest in their 20s, and then from about age 30 it decreases each year by between 1 and 2%. So andropause, which is the name that we give for seeing symptoms from low testosterone, that generally starts to be seen around the age of 50, so again similar to women. At age 70, a man can expect to have half of the testosterone levels that he had in his 20s. So what are the symptoms? What symptoms do men see? Well, as I've said earlier, some men see no symptoms at all, some men see one or two, or some see lots and lots. And the kind of things we're talking about, just as in women, mental health symptoms, so mood changes, irritability, anxiety, depression, loss of confidence, loss of motivation, insomnia, and then more physical symptoms like weight gain, erectile dysfunction, fatigue, loss of energy, breast growth. And you do see men as they get older having more breast tissue. Heat sensation changes, so being very sensitive to the temperature around them, sweating, flushes, headaches, a reduction or loss in muscle mass. And you do see older men, if you look at their bottoms for example, they've lost all of their muscle mass around their gluteal area and hips. So that is really common as well. Reduced bone density. Now this is interesting because obviously women lose bone density as well, but in women it results in osteoporosis. And whilst men do get osteoporosis, make no doubt about it, they don't get it as often as women. And that's because their start level is much higher than us. They have much denser bones to start with, so the loss doesn't affect them in quite the same way or as often. So men don't get osteoporosis as often as women, but they do still get it. And they do get this concentration problem, mental fogginess, and this inability to really function as well as they used to. So as you can see, lots and lots of the symptoms are very similar to what women go through in menopause. So I think men are just even further behind the curve in terms of accepting that they're going through this change and it's hormone driven than women are. Women now, we've got our act together and we're making people sit up and we're talking about it, but I don't think men talk about it at all. So I think it's really, really good if we can start spreading the word and getting men to talk about it. And in terms of men and women, as I've said, there are lots of similarities and there are some differences too. So for example, all women go through menopause at some point. If they live to 60, they're going to go through menopause. Not all men go through andropause, and that's an important difference. So it's not quite as definite for men. Women, obviously, once they go through menopause, can no longer reproduce or have children. This doesn't happen to men. We see men in their 80s fathering children, so they don't lose their reproductive ability. And for men, if it happens, it's very slow onset, whereas for women, it can be really sudden and happen overnight as periods stop. So just some differences between the two. So how do we diagnose andropause? Well, it's 2 blood tests, and 2 is important because, as in women, hormones fluctuate, so you want to make sure that the reading you're getting is real. So the blood test needs to be done at 9 o'clock in the morning, and it needs to be fasted, so no food at all from midnight. And both of those things are really important. If that doesn't happen, then the test isn't valid. Testosterone peaks at around 9 AM each day. That's why we do it at that time, so we get a real reading, because during the rest of the day we don't really know what the level should be for each individual man. So you go to your GP, ask for that blood test and do it in those circumstances. If both of your tests are low, then you should be referred to endocrinology so that they can investigate the cause and then obviously treat you. So what are the treatments for low testosterone or andropause? Most of them are lifestyle driven. So having an active sex life is really important because that's one way to keep testosterone high, and that doesn't mean penetration necessarily. Just intimacy, foreplay and penetration are important. And an active sex life we know is important for mental health. A healthy diet, so cutting out meat as far as possible, all processed foods, salt and sugar, and eating a very plant-based Mediterranean style diet. Exercising for 30 minutes a day we know raises testosterone levels, and it also is good for mental health and for motivation and for fatigue, so that's also something you should do. Trying to get as much sleep as you can, but obviously if you have insomnia, that's not so easy. So sleep hygiene is important, and if you Google sleep hygiene, you'll see the tips for getting a good night's sleep. Reducing stress, maybe having mindfulness, meditation, even psychotherapy to help with those mental issues that we talked about, the depression, anxiety, irritability, mood changes. Avoid steroids. Now I know for some people they can't because they need them for medical conditions, but I mean recreationally, avoid steroids. Don't take herbal supplements. We know that you can actually have severe side effects from herbal supplements that are aimed at raising testosterone, and we know that there is very little evidence for DHEA, which is often promoted as a testosterone supplement. So avoid herbal supplements and think about medications that you might be using which might be affecting your testosterone. So we spoke about those earlier in terms of opioids. And if you're in any doubt, just speak to your GP and ask them what the side effects of the medications that you're taking are. And then if all of that fails, we can replace testosterone in men, as we do in women if they need it. And that can be done in a variety of forms, from tablets to patches to gels to implants. And it's really important that that's done under the guidance of an endocrinologist, because testosterone can have side effects which are difficult to manage. So too much testosterone can actually make you angry, have male pattern hair loss, excess hair growth, changes in voice. So it's really important that blood tests are done to manage testosterone replacement and keep it within the normal range, and that goes for men and women, and I've often talked about that on the women's vlogs. So there we have it, andropause or male menopause and the symptoms that come with that. As I've said, it's controversial, but there does seem to be some evidence for it. Men definitely do lose their testosterone across their lifetime, and I think the aim of this blog is to just raise awareness amongst men and women, so that if you think your husband, father, son, whoever is going through symptoms which look like menopause to you, or look like the symptoms that we've discussed in here, get them to go along and see a GP. That's the biggest hurdle with men. They don't like talking about their health, they don't like addressing it, but it's really important, and if something can be done to make you feel better, just as in menopause, let's do it. So let's start the conversation, let's get people talking about it, and let's raise awareness for male menopause as well as for women. And I hope that's helped, and I hope it's brought a little bit of lightness to the vlogs, and share it wide. Make people that you know, men that you know, watch it. And as ever, thank you so much for watching. I've got a request actually today to do something on gluten intolerance or celiac disease, but mainly gluten intolerance, so I'm probably going to do that next. But if you have any issues at all that you want me to discuss, please let me know and I will do it for you. At the moment, as I've said, the vlogs will be monthly whilst I get this massive project I'm working on underway, and thereafter we'll go back to fortnightly. But thank you so much for your support as always, and I look forward to seeing you in August. I can't believe it. August, my little girl will be 1 in August. I do not know where that time has gone. Take care everybody. Bye for now.